Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. This is a lecture on your heart. The main focus of this presentation is how much sleep do you need per day? According to the labor statistics, here is the average number of hours based on the age group. Between 15 to 19, they get an average sleep close to 10 hours, and each decade it goes down by at least an hour, and by the time you reach age 45 to 54, your average sleep is around 8.2 to 8.5 hours. The men are represented in blue, women are represented in light green, and as we get older we regain some of that sleep pattern. If you look at the actual sleep people are getting, majority of them, about 20% of them, getting 7 to 8 hours of sleep, and there's quite a number of people who are getting inadequate amount of sleep at both extremes. Let's look at what happens when we go to sleep. The sleep is divided into stage 1, stage 2, stage 3, stage 4, and REM sleep. During stage 1, we are just falling asleep. This is kind of a light sleep. If somebody calls our name, we may be able to respond. And during stage 2, that's when the metabolism slows down, the body temperature comes down, the heart rate comes down, and you are going deeper in your sleep. Stage 3 and 4 are where you are in deep sleep. There's total muscle relaxation. This is the time when body is rebuilding itself with all the deficit that was happening during the daytime due to our hectic schedules. And the next stage is the REM. That is when the body is totally relaxed. That's when you have these dreams. It's in your deep sleep that you have these dreams. Maybe pleasant, or it could be weird, and there are a number of things that can really relate to what we dream. It may be related to something that was happening in our life. Anyway, that's the REM sleep. This cycle repeats. Generally, it like 2 hours for the whole sleep cycle to complete. So we may have like 3 to 4 REM sleeps during our 8-hour sleep in a day. And we go through the same stages of sleep where we go from light sleep to moderate amount of sleep, the metabolism slows down, and then deep sleep, then followed by the cycle repeating itself. Along with the changes we already talked about, as the metabolism slows down, as the requirements come down, the body temperature begins to fall by almost 2 degrees, from 38 to 36 degrees during the night. And of course, the temperature outside also goes down, which kind of helps, and keeping the room temperature cooler also helps to reduce the body's metabolic requirements. Thus, the body produces less heat, leading to a decrease in temperature. And as the body begins to wake up in the early morning hours and start getting ready to go to work, that's when all this muscle action and activities begin to bring the temperature back to where it is supposed to be. What are some of the causes for sleep deprivation? Sleep deprivation it's not intentional all the time. Sometimes it may be beyond your control. Sometimes you may be having a sleep disorder, or you may be having a medical problem that may be accounting for your sleep disturbances. Let's look at some of these things, because just saying I'm not getting enough sleep is not going to solve your problem. You have to see a primary doctor, or maybe see a specialist, and see if there are some preventable or curable causes for sleep. For example, narcolepsy is a condition where people have excessive sleep. They just can't stay awake. They'll be sitting in the sofa and then, hey, what happened? Oh, I'm fine. Then they wake up, and work demands. you're working 12 hours, you're traveling, and your biological clock is upset, or you may be working nights and taking care of a lot of things in the house in the daytime, and all these things can directly affect your sleep. Again, shift work, which is a very, very challenging issue, especially for nurses and hospital technicians who shift their work from day to night constantly, and that can have an effect on their sleep pattern. Again, insomnia. Some people just can't sleep. They just cannot sleep. They go to lie down in the bed, they toss to the left side, toss to the right side, sit up and stare at the smartphone or the like a notepad, and they can't sleep. And whatever they are doing, like staring at electronic gadgets, is making things worse, because that blue light that is hitting their eyes is making the brain think that they are in daylight. So then demanding home life and work life, all of this. Then there's a delayed sleep phase syndrome, and then obstructive sleep apnea. Obese people have difficulty sleeping. They just sleep for a few minutes and they start snoring and they wake up. And they're constantly interrupted sleep doesn't give them enough rest and relaxation. And there's a whole host of other conditions like REM behavior disorder, and we have circadian rhythm sleep wake disorder, a whole bunch of these disorders. And if you are having a persistent sleep problem, despite taking all the precautions and following some of the steps which I'm going to be talking about in this presentation, you still have trouble sleeping. Maybe there is something stressful in your life happening that is keeping you from going to sleep, or maybe there is something physically different in your case which may be creating you to lose sleep. And that's why seeking medical help is of paramount importance to make sure that you get adequate sleep. Sleep deprivation causes a whole host of things. It's like a cascading. Right from the time that you hit the bed and struggling there to get your sleep, you're tossing to the left side, to the right side, and sitting up and walking, doing all kinds of stuff which basically just is disrupting your sleep to begin with. And then on top of that, in the morning you wake up groggy, you're kind of restless and you're irritable, you're having memory judgment impairment, yawning. Then sometimes you feel dizzy, having hallucinations, symptoms similar to like ADHD, attention deficit disorder. It also affects your immune system over a long period of time. And there's an increased risk of diabetes with sleep deprivation. Because you're not able to sleep and because you're restless, your heart rate goes up, your metabolism goes up, your body temperature doesn't go down as it's supposed to, and it decreases your acuity. It increases aches and pains, and also it leads to the risk of obesity and other problems. And this is just sort of summarizing some of these problems we have when we don't get adequate sleep. When we don't get adequate sleep, we have impairment of judgment, reaction, emotions, immune system. So it is like a multi-system problem, and it all stems from not being able to sleep. So we had to figure out why we are not able to sleep to begin with. Is there a medical condition that can be treated with medications, or is it just you're stressed out and so get some help? Those are some things we need to keep in mind. The benefits of adequate sleep are you're totally relaxed. When you wake up, you feel fresh. It's a totally new day. You feel energized and you feel like you're ready to take on any task. And there is clear judgment when you're trying to do certain things. Your temperament is better. You get along with people better. So there are a lot of benefits to sleep besides just snoring. Even in children, it is a major problem. 6 out of 10 children, middle school children, don't get adequate sleep. 7 out of 10 high school students don't get adequate sleep. It may be all due to the advance in technology where their eyes are glued to their smart devices 24 hours a day or all the time they are awake. That may have an effect on their sleep. And also the pressure from the parents and from the peers may have a significant effect on their sleep patterns. Children are supposed to get 9 to 12 hours of sleep. It all depends upon the environment in the house. And I'm going to give you some tips on how you can try to improve your number of hours of sleep and improve your sleeping habits. First of all, you need to avoid the things on the left hand side here which interfere with your sleep, like caffeine, tea, alcohol, cigarettes, all of which are stimulants. They will increase your brain activity and thus prevent you from going to sleep. Overeating, too much food, then watching television or smart devices, watching horror movies in the night, or just staring at the gadgets all night long are not going to help. Then hold training. All these are some of the things that you want to avoid, especially as you get closer to your sleep hours. Whereas you can improve your sleeping by having a proper sleeping habits. I say good sleep habits. Take a walk before you go to sleep. If you can walk for like 20 minutes, that will be a great way to just hit the bed and go into deep sleep. Keep the temperature below 1 or 2 degrees from your normal temperature. Then easy reading like a book, not a device, because those devices have LED lights which will keep your eyes wide open. Then ventilation of the room is important. Most of the time, bedrooms have only one vent coming in. You don't have a vent going out, and if you close the door, the air gets trapped. As a result of that, either your bedroom is too hot or too cold or too humid, and this happens in practically every bedroom because when you close the door, you don't have air circulation, because all you have is one vent that is pulling the air, unless you have two vents which are circulating the air. Then you have to have a set regimen. You make sure that you go to bed at 9 o'clock, 10 o'clock, whatever the time you set, and make sure your alarm is set to make you get at least 7 to 8 hours of sleep. Even meditation can help you to get into that relaxed state of bringing your heart rate down, bringing your body temperature down, and bringing your mind to a calm level before you go to sleep, rather than staring at those smart devices. Ladies and gentlemen, this is a quick overview of how much sleep you need, how much sleep you are getting, how you can improve your sleeping habits, and how you can get more sleep and be less stressful and more productive. We have a series of presentations on your heart health. Please do watch them, and please do subscribe to our channel, and I will see you in the next video. I am Dr. Nik Nikam from Houston, Texas. Thank you so much.